Okay, well, what about breast surgery? I know you do a lot of breast surgery as well, and breast
Yeah.
augmentation has been a big part of your practice. And I mean, breast augmentation has really changed a lot over the past 4 decades. Again, when I think of breast augmentation, the evolution of breast augmentation, the techniques are very much the same, but what's really changed is the implants and the technology of the implants, and that to me is kind of the biggest evolution of how things have changed and changed for the better. Would you agree with that? I mean, the implants really are different than they were even 10 years ago, let alone 20 years ago and 30 years ago.
Yeah, it's an interesting observation, and there it's a two there's a two-side answer to that. If you looked at the breast implants that were invented in the 60s, I think the first one was silicone in 63, and then the saline implant in France came along in 1965. I'm talking 1963, 1965. That's more than half a century ago. And if you could hold one of those original implants in your hand and hold a new one today, your average person would say these things look the same. They're plastic bags filled with something, and really on the surface, they really are. We haven't gone beyond plastic bags filled with something. There's a lot of hope that fat grafting would have worked, and maybe stem cells might one day do the trick, but we're still looking at plastic bags. But as you have said, those devices have evolved, and they've had to evolve because there were some real issues. In 1992, silicone implants were banned in Canada, and we only had saline-filled implants for about a decade. And I think that made the companies that make these implants uh, do a better job. And I think the current silicone implant is probably, it's been said, it's one of the most tested devices, medical devices in the history of the world. It's been tested in tens of millions of women, and we sort of know what it can do, we know what it can't do, and we know what the problems are.
I tell my patients that as well, and I don't think people recognize how thoroughly tested breast implants have been, and people still think. I mean, I still get patients who somewhat think they're experimental, and it's quite the opposite. I mean, these are, as you say, the most tested biomechanical devices that's been put in human bodies.
Yeah.
But can you talk a little bit? You lived through that '90s era when implants were taken off the market, and there were some legitimate concerns that people had, and they were brought back on the market, and now we start to revisit some issues that people are having again. Do you see similarities between some of the concerns that people have and now, as opposed to what people voiced in the '90s?
Yeah, it's a very interesting question, Arjang. I think it's a new generation, and the new generation that's come along are really saying much the same things that the generation in 1990 was saying, which is there are unknowns. There is a strange breast implant illness that we can't define. People back in the 90s were talking about arthritic symptoms, autoimmune symptoms, their hair fell out. And really, what happened was after these studies were done, it was not possible to scientifically connect A to B as it is now. Breast implant illness is something that people talk about, and I think if a woman wants her breast implants out, that's her right to get them out if she feels that they're making her sick. But we still can't connect the dots. So I do think the concerns are very similar to what they were back in the 90s, and I don't know if we'll go through the same banning process. I doubt it, but the concerns are not much different. That's being said, the implants that were banned were not the quality that they are now. That they had a leak rate that was high, a rupture rate that was high, and there clearly were problems with liquid gel getting into the breast tissue, causing lumps and that sort of thing. So
Yeah.
we're in a better boat than we were then.
Yeah, and I mean, people I think mistakenly um, mistake breast implant illness with the issues with textured implants, and
Sure.
clearly that's different. I think that's got to be clear. Now, again, I've told you this before. Textured implants have been taken off the market, and in the kind of in the case of biocell implants have been recalled, and that's well known and well out there. But I actually never liked the textured implants. I'll be honest with you, and I actually really didn't like them. Go so far as to say I hated dealing with them and I hated putting them in. I think I put in 2 in my practice, and it was very early on when they came out, and there was a lot of discussion about them. And I thought that they'd be a good implant to try, and we discussed that with my patients. But when I actually put them in, I really, really strongly disliked them, and I never used them again, just simply because I didn't like them. I was always surprised that people like them, quite frankly. Did you use them?
Yeah, it's interesting to hear you saying that, Arjun, because I was on exactly the same wavelength. When they came along, I was interested. I listened to all the papers. I listened to, the whole idea. When a new idea comes along in plastic surgery anyway, there's always the zealot phase where you feel like you're missing the boat if you're not on the train. And then it suddenly starts to wane. It always wanes, and it somehow finds a level. When the zealot phase was happening, I backed off, and I used, I think, perhaps 2. I mean, it might have been the same number as you. I might have used textured implants in 2 patients, and they weren't shaped. They were just round implants in patients where I was doing revision surgery for capsular contracture,
Yeah.
and they weren't
Yeah, that was
aggressively
the same.
textured either. And that was my use. It just always gave me the creeps putting something in somebody that was supposed to irritate them to such a degree that they'd form a scar. So I kind of never got on that train, but I understand the people who did. It was the logic was there why they may be better, and it's unfortunate that there were issues. Certainly, the ALCL thing that came along was not something we could have anticipated, and it's too bad. But anyway, I think we did the right thing by stopping them.
Yeah, I mean, I wonder about that zealot phase that you refer to, and this happens, I think, not infrequently, where something new comes out and it's presented, and people are very strongly pro whatever this new device or technology or technique is, almost to the point where, if you're not for it, you're not even going to get a chance to speak about it at a conference or whatnot. And then all of a sudden, a couple years later, it becomes clear it wasn't really the right direction, and you kind of feel like, geez, I don't know. There's got to be some inherent bias about this kind of promoting these new things that if you're strongly for it, you kind of hear it a lot. Do you know what I'm trying to say here? I feel like sometimes we need to temper some of these new devices a little bit.
In medical school, part of the deal is to make a person who can think on their own, who can make their own decisions on behalf of their patients and decide what they think is best. And I think that's something that in plastic surgery we have to remember. We have to keep our patients' welfare in mind, and be careful about adopting anything that somebody's promoting without really doing a lot of soul searching about it. I got this feeling when I look back on it that there's things that people have jumped on, like buttock augmentation with fat injected, huge volumes of fat deep to the buttock, and that killed people. And we've had people going blind with lots of filler injections in the glabella. Yet at the time, that was the state of the art. That was something that somebody would be on a podium telling us that if we weren't doing that, we weren't state of the art. So with that kind of history, you have to say, well, maybe this next greatest has to be observed a bit more carefully too.
Yeah, I mean I think that's something that I've struggled with, and I know kind of anybody who is in the industry struggles with this idea that if you're not actively doing whatever is the newest thing and being at that cutting edge, people you're not getting attention at conferences. And so where's the role for the conservative surgeon who's kind of just doing what's safe and not necessarily getting asked to discuss it all that much. There's got to be still a role for that, kind of temper your propensity for jumping into the newest before realizing what really is the best for patients.
This speaks a little bit to how a young surgeon, for example, and maybe not a young surgeon, any surgeon now, promotes their practice. It used to be that there was no advertising, there's no internet, there was just a telephone book. And I used to I still, I guess, take the attitude that if you do good work, eventually the patients will find you, and you don't have to promote yourself. You don't have to do the latest and the greatest, because if you just do good work and make happy patients, the people will come to see you. But I do think it's different. I think for young surgeons now, they feel it's a competitive environment. They certainly need to be in the social media realm, and they have to tell the public that they're right up there with the latest and the greatest. So it's probably tougher for a younger plastic surgeon now to resist that temptation to jump on the newest thing, because if they don't, the guy across the street will. So I get it, but I still think that the tried and true approach is doing good work, get good training, do good work, and produce happy patients. And in the end, those surgeons are the ones with the thriving practices and happy people.